supply of the nasal cavity. Then there is paranasal sinuses. Paranasal sinuses there are four named pair of paranasal sinuses. There are two frontal. These are present in the frontal bone just above the medial aspect of the orbit, and they may extend posteriorly into the roof of the orbit also. There is a pair of ethmoidal sinuses. These are present between the nose medially and the orbital cavity laterally. Then there is maxillary sinus. It's a very big sinus. It's a triangular. It is present lateral to the nose below the eye, and it is covering almost whole of the maxillary bone. It is hollow from inside and due to the maxillary air sinus. And then we are left with the sphenoid sinus. We cannot see, we cannot represent on the interior aspect. We have to see from the lateral view. So it is on the body of the sphenoid on the posterior superior aspect of the nose. So here is a schematic diagram showing the chambers relation. The frontal air sinus is anterosuperior to the nose. Sphenoidal air sinus is posterior to the nasal cavity. The ethmoid air sinuses are lateral to the upper part of the nose, between the nose and the orbit, and the maxillary sinus is mostly forming the lateral wall of the nose and even extending beneath it, below it. The nasal air sinuses, these are lined with the respiratory epithelium, and epithelium produces mucus, and it has respiratory epithelium that has cilia that beats towards it, and they bring the cilia to the opening of the sinuses into the nasal cavities. And the function of these is to lighten the weight of your skull. It makes the skull lighter. It gives a quality to your sound. It gives a resonance to the sound. गूंज देती है आवाज. It gives resonance to the sound, and it helps in that's the facial function, and the major role is expansion of the skull without adding to the weight too much. So this is the functions, the innervation, and you may see the change in quality of the sound if you have suffered, I hope so not, but if you have suffered from sinusitis and your sinusites get filled, you may see the um, change in the quality of the sound. Maxillary sinus, also known as maxillary antrum of high mode, it is present on the each side of the nasal cavities. It is pyramidal in shape. Let me go back a slide. There is a little better presentation of the slide. So it is present in the maxillary bone. It is present below the orbit. It is present lateral to the nose, and it goes all the way sometimes inside the zygomatic bone too. Anteriorly, it is bounded by the wall that is covering making the prominence of the cheek by the maxillary bone, and on the back it is related to the pterygopalatine fossa and the infratemporal fossa. So this is an alternate picture from the Grant's atlas from the coronal section. So you see the relation. There is orbital cavity above, there is teeth below, there is nasal cavity on the medial aspect. That said, it opens through this opening, that is the opening of the maxillary sinus, and you may notice that the whole of the maxillary sinus is below it. So this is the sinus that gets infected very easily because the fluid has to move up to go to the nose. It has actually, in the normal situation, the cilia are beating that are moving the film of fluid all the way up, and when there is a sinusitis and there is actually fluid that is standing here, it keeps on accumulating down until the way you lie on your one side, and the sinus that is higher, it drains. And you may have noticed everyone usually go through the flu season once or twice a year, and when there is a stuffed nose, you cannot breathe through the nose, and then you lie on your side, and the nostril and the nose that is on the upper aspect, like I'm lying down on my right side, my left nose, it sometimes give a flow of fluid. This flow of fluid is basically the draining of the maxillary sinus and the nose gets opened. Then you lie down on the opposite side, your left cheek touching the pillow, and then the right nasal sinus, then maxillary sinus drains. And if you are lucky enough and if the fluid is thin enough to flow. So this is about the maxillary sinus, and I will be talking about a few things about it. The maxillary sinus, first I will be talk about the development. All the sinuses except the frontal sinuses are present at birth. So these are color coding is done at the level of birth. It is a very small slit, basically the yellow, and it goes on to extend as the person grows in age. By roughly 8 years of age, the floor of the nasal cavity, it's at the level of the floor of the maxillary sinus. In the latest pictures, it is written 12 years. I was reading the last anatomy, it was written 8 years. So by 8 to 12 years, the floor is by this age, and as you grow older, the floor of the middle meatus, middle paranasal sinus is, sorry, the floor of the maxillary sinus is going beyond it. And you can see as the floor goes down and down, the thickness of the bone that is separating root of the root of the teeth, it usually includes the molar and premolar, it grows thin. And in the older people, the root is included inside the maxillary sinus. So in very old people, you may see either a very thin cortex of a bone around the maxillary sinus, around the root of the tooth, as it is entering the maxillary sinus, or there may be actually no bone at all covering the root. It's simply covered with mucous membrane of the maxillary sinus. And this point of information is very important because dental infections and dental extractions may affect the maxillary sinus. And infection of the dental roots may lead to maxillary sinusitis and vice versa. An old person and a young person, as we go younger and younger, there's a thicker set of bone between the two, so there is the possible communication, and in an older person the tooth falling may lead to a permanent opening of the maxillary sinus in the oral cavity. So this is about the maxillary sinus here. It ostium, accessory ostia, and fontanelle. So this is a little crowded picture, and don't get overwhelmed by all of the things at once. Just keep your focus on the yellow area. This is the maxillary sinus. This is the gutter of the bone, the semilunar. This is the infundibulum and semilunar hiatus. And as we move down the infundibulum, there is an opening in the bone. That was the opening for the maxillary sinus. So this is the opening that you were seeing from, sorry, that you were seeing in this picture right here, in this picture right here, and in this picture right here. This is the opening that was you were seeing in the different pictures. So here you can see the ethmoid bone is so much. This whole area, there is no bony covering. There is no bone separating the nasal cavity from the there is a no covering the nasal cavity from the maxillary sinus. This whole area, the back aspect beneath the uncinate process in the inferior concha, inferior meatus, this whole area, it's not having any bony difference. And this in this area, the only separating thing from the maxillary sinus and the nasal cavity is membrane, is the mucous membrane covering the nose from the outside, and the mucous membrane covering the maxillary sinus from the inside. So just like the fontanella of the cranial cavities, which are only there is no bone but skin and membrane are, this area are called the fontanella of the sinus. This area is called the fontanelle of the sinus, and through these areas additional openings may be present. These additional openings, 1 2 3 labeled in this picture here, these are called accessory ostia. Accessory ostia, these are the accessory openings. And some of you will be going into the ENT surgery, and these are the places, the fontanelle, where we create artificial openings In a person who gets maxillary sinusitis recurrently and who does not have a very good drainage of the maxillary sinuses. So this is all about the maxillary sinuses. We talked about its relation, its extent, its development, its drainage, its ostia, accessory ostia, and fontanelle. So this is about the maxillary sinuses, and any inflammation to the maxillary sinus will lead to the tender area in front of your cheek. Okay, next there is ethmoidal air sinuses. First, let me show you on this picture. Ethmoidal air sinuses are present in the lateral wall of the nasal cavity. This is the wall of the nasal cavity, on the lateral aspect of the nasal cavity, and on the medial aspect of the oral orbital cavity. And orbital cavity, when we were talking about the walls of the orbital cavity, we talked about the ethmoid bone, and the part of the bone that was towards the orbit, it was very thin, and we named it lamina papyracea. This is the same thing. And on the superior aspect, it is covered with the process of the at frontal bones. It is covered by frontal bones superiorly, and on the back it is covered by sphenoid bone, and it is front, it is covered by frontal bone, and medially there is a nose, laterally there is an orbit, and below there is simply hiatus semilunaris. And these bones, these set of bones, this set of sorry these sinuses, these set of sinuses are divided into two parts depending upon the attachment of the basal lamina, the attachment of the middle meatus. The sinuses that are present behind and up to the middle meatus, in other words, that are opening into the superior concha and sphenoidal recess, these are known as posterior group of ethmoidal cells. And the ones that are inferior to it, these are called anterior group of ethmoidal cells. The ones that we talked about opening on the top of the ethmoid bulla were the middle, and the one that we talked about were opening into the infundibulum were the anterior ethmoidal cells. These ethmoidal cells may vary in number very much. They may be as less as 3, as much as 18, but they are present and they are divided into anterior posterior groups as discussed. Sphenoidal recess is the one that is present in the body of the sphenoid bone. So it has a posto-superior relation to the bone nose. Its septum, it is divided into two sphenoid sinuses by a septum present between them that is usually not very strictly in the midline. It may be deviating on one side or the other. And the sphenoid sinus, it's anteriorly, and anteroinferiorly, it is related to the nasal cavity. Inferiorly and posteriorly, it is related to the pharynx here. Superiorly, it is related to the pituitary fossa, and on each side it is related to the cavernous sinus containing internal carotid artery and the four cranial nerves. So this is about the relations of the sphenoid bone. Pharynx below, pituitary above, carotid sinus on each side, and anteriorly there is nose, and totally posteriorly through a thick bone there will be basio-occipital. The thing about sphenoid air sinuses is that it grows larger and it grows posteriorly with age. So in a newborn and in a younger person, the sphenoid air sinuses is inferior to the pituitary fossa. As we go back, it may cover whole of the floor of the pituitary fossa in an old person. So it depends upon the age, and with age, the fossa may extend even laterally into the greater wing of sphenoid. And this brings us to our last sinus, that is the frontal sinus. It is present on the top in the frontal bone. It is usually present in the vertical aspect, that part that is making the forehead, and it may extend horizontally onto the orbital plate of the frontal bone also. The important MCQ regarding is, this is the only sinus that is not present at birth. You may look at the yellow color that is absent right here. It is the only sinus that is not present at birth. It opens below downwards into the frontonasal duct that enters the infundibulum, and so it opens here. And here you can see that it has an intimate relation with the maxillary sinus. Any inflammation of the, if there is any inflammation of the frontal sinus, the infected exudate, if it is coming down, it will run into the infundibulum and the gravity will do its work and the infection will lead to the maxillary sinus. So a person suffering from frontal sinusitis has a very high chance of getting maxillary sinusitis also. The reverse is not true because it will have to go against the gravity. So that is all about the sinusitis. That is all about the sinuses. I will be concluding my lecture here. In the beginning I mentioned that I will be using uh, talking about the larynx, but this video has gone long enough. So these are the resources I have been using. So thank you so much. I will make a separate video. I will upload it on the same day about the gross anatomy of the larynx. Thank you so much. If you have any questions, suggestion, or feedback for me, please do mention in the comments below. Looking forward to hearing from you and getting your support. See you in the next time. Good night. Allah Hafiz.